You know, without you, I couldn't have ever made it. And with
Honey, you could
your
do
support.
anything by yourself.
No,
Yes.
not anything this serious. I went in for exploratory surgery. While they were there, they discovered that it wasn't diverticulitis, that it was ovarian cancer.
When someone's diagnosed with cancer, other family members want to know, am I at risk? Should I have different screening? Are there any other things that should be done for other family members? And we're also involved with that and linking them to the right people or giving them that education.
Hereditary cancer means that you're born with a gene alteration, also called a gene mutation, that places you at a high risk of developing cancer. So if you already had cancer and we know you have that gene mutation, then you have a hereditary cancer syndrome.
They discovered that BRCA analysis, and they wanted to do that because I have a daughter and 4 granddaughters.
It was one thing to treat GYN cancers, but it was another thing to make a resource available to the community for people that may be at risk, such as other family members, because everyone wants to know. So we developed this genetics education program with that in mind.
Genetic testing is helpful because it helps us identify who has a hereditary cancer syndrome. The first step would actually be genetic counseling, so looking at that individual's family history, trying to decide, are they at an increased risk? What genetic testing is useful or helpful, and who in the family is the most appropriate person to begin that testing with.
The genetic testing was just the most promising thing I had that I could give to my daughter.
Seeing a genetic counselor would be to try to identify, are they at risk themselves for getting a second cancer, or are other family members, sisters, daughters, can they pass it on to sons and their kids and their offspring? So that's one group of patients. The other group of patients are patients that have multiple, they themselves don't have a primary cancer, but there are multiple family members that do have linked cancers, and they want to know, what is my risk?
She had the genetic testing immediately, was prepared. She was 35. She was totally ready to have both breasts removed and her complete hysterectomy if she had the mutation gene, the gene that BRCA analysis shows. She does not have the gene. So just to take that worry off of her and myself and my granddaughters was more valuable than anything it could have ever given me.
I urge people to, if they have questions about these various cancers, maybe it's not by accident, maybe they ought to see a counselor and get that evaluated.